talk about varicose veins. You know what they are. They are those bluish or purplish bulging veins that develop in the lower leg and thigh, often behind the knee. Unlike the tiny and superficial spider veins, varicose veins are not just a cosmetic problem. They are a medical condition that can worsen and lead to significant complications. We can see the bulging veins because they have become swollen and distended due to malfunction of the delicate valves that control blood flow within them. The blood, instead of flowing towards the heart the way it's supposed to, instead flows towards the feet, increasing pressure on the walls of the vein. Let's talk about the symptoms of varicose veins. Varicose veins are not just unsightly, they come along with troubling symptoms. For instance, patients with varicose veins experience heaviness in the legs, aching, swelling, and even throbbing. The skin over the bulging vein can be itchy and feel sore. The veins themselves can hurt as they become more and more distended and tortuous. As the skin becomes thin and inflamed, these symptoms continue to progress. Let's talk about the causes of varicose veins. The function of veins is to carry blood to the heart from the extremities. The muscles of the legs squeeze the veins, pumping the blood towards the heart. The blood is kept from flowing backwards by tiny valves which are like flaps inside the veins. Sitting or standing for a long time causes pressure to increase in the veins and the walls to stretch, damaging these delicate valves. When this happens, more and more blood pools in the veins of the legs and they become big and tortuous. Varicose veins run in families, perhaps because there's a genetic component to the strength of the valves and the walls of the veins. The risk of developing varicose veins is 90% if both parents were affected, 25% for males and 62% for females if only one parent was affected, and only 20% if neither parent is affected. Factors that can increase your risk for varicose veins include being overweight, not exercising enough, smoking, pregnancies, and having a job that requires long periods of standing or sitting. Let's talk about diagnosing varicose veins. The first step is taking a detailed clinical and family history. Women are more likely to suffer from varicose veins than men, and the disease usually affects people between the ages of 30 and 70. Another risk factor is a family history of venous disease. A physical exam is the next step. The doctor will examine your legs for any bulging veins, and if these are present, their texture and color. He will examine the skin overlying the veins for color changes, thickening, or skin breakdown. The definitive test for proper diagnosis is a complete venous ultrasound. This exam will study both the deep and superficial veins to assess the patient's overall circulation. The quality of the ultrasound is very important in order to determine which vein is causing the problem, as well as its size and location. The severity of the problem also needs to be assessed. Ultrasound examinations are very operator dependent, which means that vascular laboratories must be accredited to ensure they have qualified technicians performing the correct protocols. For example, the superficial veins must be checked while the patient is in the standing position. Getting to the right treatment requires the correct diagnosis. Patients should make sure they are evaluated and examined by a surgeon with an accredited ultrasound laboratory. Let's talk about the treatment of varicose veins. It's important to treat varicose veins because they can worsen without treatment, leading to significant complications. The first methods tried are conservative, especially if the disease is mild or in the early stages. Conservative treatment includes elevating the legs daily to reduce swelling, as well as the use of compression stockings. These are elastic stockings that squeeze the veins, stopping the abnormal flow of blood back toward the foot. The stockings can relieve symptoms and help heal skin sores, as well as prevent their return. Some patients are required to wear the compression stockings for life as a way to control symptoms, although they won't cure the underlying problem. When these kinds of treatments alone do not relieve varicose veins, the patient may require a surgical or minimally invasive treatment, depending upon the extent and severity of the disease. These treatments include sclerotherapy, ablation, and phlebectomy. During sclerotherapy, ultrasound is used to guide a needle into the affected vein to inject a liquid or foam medication. The medication scars the vein from the inside out, closing it. Blood that would normally return to the heart through these veins returns to the heart through other, healthy veins. The body eventually absorbs the treated veins using its natural healing processes. Sometimes, the best treatment is phlebectomy. In this procedure, a small incision is made overlying the varicose vein. The surgeon uses a small hook to physically remove the affected vein or the cluster of veins through the incision. Ablation is a treatment that uses a thin, flexible tube called a catheter inserted into a vein in the leg. Tiny electrodes at the tip of the catheter heat the walls of the vein and destroy it. There are two types of ablation techniques, radiofrequency and laser. Both methods effectively eliminate the diseased vein using heat. Your doctor will decide which ablation method is best for you. Let's talk about what kind of results you can expect after treatment. Once a patient has been treated, he or she can expect immediate results. The varicose veins will be completely gone after the procedure. Bruising and inflammation, however, may take some time to clear. If there was skin thickening or discoloration prior to the procedure, please be aware that this is most likely permanent. Any existing ulcers will begin to heal slowly after the surgery. Bandages and ointments may be used to expedite healing. The leg may feel tender or sore for a few weeks after the procedure. Symptoms that were present prior to the procedure, such as achiness, swelling, and heaviness, should slowly decrease within a few weeks. Let's talk about preventing varicose veins. Unfortunately, there is nothing we can do about our genetics. If both our parents had varicose veins, there's a great chance we will too. However, we can help by getting plenty of exercise and losing weight. That is, if we are sedentary and overweight. Elevating our legs after a long day at work may also be helpful. If there is a family predisposition to varicose veins, it may be wise to wear compression stockings to help slow their development. Also, in this case, it's a good idea to consider an ultrasound of the veins of the legs to detect any problems which have not yet become symptomatic. Varicose veins are bulging, abnormal veins in the legs that may lead to further complications if left untreated. Symptoms may include pain, heaviness, swelling, skin damage, and ulceration. Treatments are minimally invasive office procedures, and results are excellent and immediate. If you liked our video, check out our other videos on YouTube, follow us on Facebook, and share this site with your friends.